everyone, Anna here with the Coding Guild. Today we are going to have a look at MSDRGs in more detail and will examine how the system is built, what information factors into the final MSDRG assignment, and how it all comes together with present on admission indicators, hospital-acquired conditions, and the CC exclusion list. What are MSDRGs and why do we have this system? In the most simplistic terms, MSDRGs are kind of a sorting mechanism that will help CMS quickly decide what payment bracket a patient should fall into for their inpatient stay. As we know, patients in acute care facilities can command extremely high prices for complex traumas, or they can cost close to nothing if they present for a simple fracture, for example. In the prophy and outpatient world, it is easy to calculate the cost because we are using procedure codes on a fee-for-service basis or with bundled payments. But unfortunately for inpatient stays, it is not going to work like that. So instead of paying these facilities on a fee-for-service basis, CMS created these all-inclusive package deals that we call MSDRGs. The MSDRG will be connected to either the patient's principal diagnosis or the principal procedure that is performed. We are going to look at these in more detail in a moment. So using procedures to substantiate payment makes a lot of sense and it's very logical, but why would CMS opt for using the principal diagnosis in most cases? Well, the logic behind this is that modern medicine is using treatment protocols. When a patient shows up to the hospital, the doctors already know what is going to happen to that patient. They know what type of drugs are going to be needed, how intense the nursing care is going to be, how long the patient is expected to stay, etc. They don't know the exact details for that one patient, of course, but in general they have an idea as to what they expect to happen next. CMS capitalizes on this by putting price tags on these known protocols. CMS can calculate how much any given inpatient stay shall cost if the hospital adheres to established medical guidelines as they are expected to do. Don't forget that CMS has access to actual cost data because facilities are expected to send CMS cost reports. Under the MSDRG system, CMS assumes that all patients who show up with the same diagnosis will consume roughly the same amount of resources and will cost more or less the same amount of money to be treated. Because of this, patients presenting with the same principal diagnosis or same principal procedure will always end up in the same MSDRG if it's a simple case. All MSDRGs have a relative value assigned to them, what shows how intense and expensive that given diagnosis is to treat compared to all other diagnoses and MSDRGs. So why is it good for CMS to have this MSDRG system? Well, in short, it saves them time and money. They don't have to bother with itemized bills for inpatient admissions, and they also know in advance how much they will be expected to pay for any given inpatient admission. Again, it is based on medical protocols. They expect the hospital to treat the patient presenting with the same problem according to the established protocols, and they already know what that entails, what kind of procedure, what kind of resources, etc. It's easy to price. The general idea with this system here is that for average cases, CMS will not adjust the payment. They assume how much this patient will cost based on the protocol. They price the package according to their expectation and then they pay that price. For normal cases, this package deal price is all the facility gets. This is how CMS saves money with this system. This can be either good or bad for the facility because if they are efficient and can treat the patient for less than what they get from CMS, then they can keep that amount and make a profit. On the other hand, if they are wasteful and not effective enough, they will lose on that patient. Of course, we have to add that this is the general idea and there are always cases where CMS acknowledges the need for additional payment. Now let's see how we actually find MSDRGs.